Hello, I'm Dr. Matthew Walker. I'm a hand and upper extremity surgeon with OrthoIndy. We are just waiting for a few people to log in here, and then I'll give a little bit more of an introduction. Okay, so again, my name is Matthew Walker. I specialize in hand and upper extremity surgeon. I've been here at OrthoIndy for about a year. We're planning to talk about carpal tunnel syndrome today. Before we get into that, I was just going to introduce myself a little bit, give you a little background information. I'm originally from Illinois. I went to medical school in Chicago at the University of Illinois. I did residency down in Houston, Texas for about 5 years. And then I went up and did fellowship in Milwaukee, Wisconsin at the Medical College of Wisconsin. So today we're going to talk a little bit about carpal tunnel syndrome. Carpal tunnel syndrome is a very common problem that we see in hand surgery. The main symptom of carpal tunnel syndrome is numbness, tingling, and pain in the hand. The cause of carpal tunnel syndrome is compression on one of the nerves in the wrist. Specifically, that's the median nerve. That's the nerve that goes to the thumb, the index finger, the middle finger, and the ring finger. Commonly, people feel that they have numbness in the whole hand, and when you really look hard at it, the small finger is pretty normal. But this pain is pretty common. It wakes up people at night most commonly. Most people feel that they have to wake up and shake their hand out to try to get rid of the pain. Additionally, you can get symptoms during the day. This is often when you're doing activities, such as when you're working or when you're driving. Anything that puts your wrist in a position that's bent or really extended can increase the pressure on that nerve and make the symptoms worse. Occasionally, when the carpal tunnel gets worse, you can have more profound numbness. You can also get some weakness in the hand. It's also not uncommon for people to feel that they're not able to hold objects or do fine motor activity. They feel that objects slip out of their hand. That's another common symptom when carpal tunnel gets a little bit more advanced. There are multiple treatment options for carpal tunnel syndrome. The most common treatment is using a wrist brace. So in carpal tunnel, a lot of the problem comes from the wrist being in a bent or an extended position. This puts more pressure on the nerve and can lead to those symptoms. A wrist brace keeps the wrist straight and is especially useful at night. A lot of people sleep with their wrist in sort of a bent position, which can cause those symptoms. So by wearing the wrist brace, keeping the wrist straight at night, that can lead to a lot of improvement with sleep. And occasionally that can also lead to good improvement with daytime symptoms as well. So usually I would have people wear the brace full time at night. And then also if there are particular activities during the day that cause the numbness, it's also helpful to use the brace during those activities. Usually you don't want to use a brace full time. Otherwise it's like a cast and can make the wrist quite stiff. If a brace stops working, then there's a few other options. Also, if your symptoms are a little worse, like if you have any muscle weakness or kind of constant numbness in the hand, usually at that point I would consider getting more testing. There's a test called an EMG, which basically looks at how the nerve works with the muscle, and then also looks how the nerve conducts across the wrist. And that's a test you get to see how severe the carpal tunnel is. It also helps you decide if there's anything else going on, if there's any issue with the elbow or with a pinched nerve in the neck. So once you have that information, then you can make a determination about other treatment options. One other common option is a steroid injection. In a similar fashion to the brace, the thought behind the injection is to bring down pressure in the wrist. So the goal is to bring down the swelling, relieve the pressure from the nerve, and that can help with the symptoms. So we did get a question. Can people get arthritis in their wrist from cracking their knuckles? Thank you for the question, Ashley. That's actually kind of a controversial issue. In general, we don't have good proof that cracking your knuckles will cause arthritis in the hands. I actually do it myself, so maybe I'm one of those people that will get arthritis, but honestly, we don't have good proof of that. So, a little bit more about injections with carpal tunnel. We do find that sometimes the injection can be helpful as well when you're trying to decide between the cause of numbness in the hand. So if somebody has pain in the neck and then also has symptoms of carpal tunnel, an injection can help you sort out where the numbness is coming from. Typically, though, we find that when an injection wears off, the symptoms can come back. So most people will get some recurrence of symptoms within the first year after an injection. And then there's the other option for treatment, which would be surgical release of the carpal tunnel or carpal tunnel release. A carpal tunnel release basically is you create a small incision in the palm, you release a ligament that's on top of the nerve, and then that opens up the space for the nerve. That can lead to a lot of improvement immediately with the tingling symptoms that wake you up at night. And then depending on how bad the EMG is or how bad the nerve has been compressed, usually you will see some improvement in the numbness. If you have mild carpal tunnel, most of the numbness will go away, if not all of it. If you have more advanced carpal tunnel, the surgery prevents you from getting worse, but you may not have complete relief of all of your numbness. It still usually helps a lot with pain, especially with that tingling pain that people get at night. So for anybody out there, we are taking questions. So if you have any questions, feel free to send those in and we'll address those. So one common question I get about carpal tunnel surgery is, what is the recovery like from carpal tunnel surgery? So typically the skin heals by about 2 weeks. At that point, you remove the sutures, and then I don't really have a restriction. I usually don't let you lift more than 5 pounds or do any heavy pushing with the hand for the first couple weeks, just to help prevent any issues with the wound, with the sutures popping. After that, once the wound is fully healed, typically you can do activity as tolerated. It's very common to have some soreness in the palm after a carpal tunnel release. That can last anywhere from 4 to 8 weeks with kind of normal daily activity. For people who are looking to get back to work, if you're doing more of an office type job, oftentimes you can get back in a week or 2 to 3 weeks, depending on how bad your pain is. People who do more heavy physical labor where they're pushing with the palm can take a little bit longer to get back to work. So that can be anywhere from 4 to 6 weeks depending on what exactly you do. In general, I tell people you're not going to hurt anything that we did in surgery. It's going to cause pain, which would be annoying for you, but isn't really damaging anything further. And then another issue you can get, if you're pushing really hard on the palm, if you're in a push-up position or you're pushing up with your hands to get out of a chair, occasionally you can have some soreness at the incision for even longer. Usually by about 4 months, that has completely resolved. And then we talked a little bit about the numbness. The nerve is typically kind of slow to recover. So if you had more severe carpal tunnel, you can continue to see improvement for about a year out from surgery. So we're getting another question. This one is about trigger finger. What are the common signs of trigger finger? So trigger finger is another very common problem in the hand. This problem causes a clicking sensation in the palm. So usually it's when you bend your finger, you'll feel clicking and a little bit of pain, and then when you try to extend it, the finger will pop open. So it'll look something like this. You bring the finger down, the finger can get stuck, and then when you try to extend it, it can kind of pop open. When it gets really bad, it can sometimes get locked down, and then you actually have to use your other finger to push it up. So that's another very common problem that I treat. That's one that can respond to bracing sometimes, especially if you wake up at night from the finger being locked down. Sometimes a brace that keeps the finger straight will prevent you from having that start. Another very common treatment for that is an injection into that area to help bring down swelling around the tendon. What trigger finger actually is you have these long tendons in your fingers that come all the way down your hand. There are little sheaths that hold the tendons down to the bone, and sometimes those can get a mismatch in size. So the tendon gets a little too large, doesn't fit through the sheath very well, and that's what causes that sensation. So the goal with an injection is you bring down the swelling, and that can provide very good relief. Sometimes trigger finger also needs a surgery, which usually that's a pretty benign surgery, pretty quick recovery. And again, if anyone has questions out there, we can go over any of those questions that you have. Just leave those at the bottom. So I had a few questions from before the session, and I'll go to one of the other questions. One of the common questions is, when can I drive after surgery? I don't have a specific restriction on driving. You do have to realize that if you've had surgery on that hand, your reaction time with that hand is not going to be quite normal. In general, if you're taking some narcotic pain medication, you don't want to be driving. But I actually have some people that we do the surgery with local medication only, and you can actually drive yourself to and from surgery if that's the case. So we got another question about arthritis in the fingers. So the question is, if you have arthritis in your fingers, what are some ways to cope with that? So arthritis in the fingers is very common. It's a much more common problem to have than to have treated. But if you are having a lot of pain in the fingers, kind of the simple things you can do are pain medications like anti-inflammatories. This would be medications like ibuprofen, Motrin, or Aleve. That's if you haven't had a problem with reflux or any kind of stomach bleed, then they're pretty safe for you to take. So those can help quite a bit with the pain that you get in individual joints. If you have one joint in particular that's very painful, you can do an injection into that joint, basically a steroid medication to help bring down the pain. It doesn't cure arthritis, but treats the pain symptom. Occasionally you can brace a finger as well. It depends on which joint is the issue. And then also there are surgeries for finger arthritis. Again, it depends which joint, but there's surgeries including fusing a joint or replacing a joint, and those can be very successful surgeries. Another common question I get is, what causes carpal tunnel syndrome? So there's not always a good answer in everybody for what's causing carpal tunnel. The underlying problem is that you have more pressure in the tunnel, and that's squeezing on the nerve. And that's what causes those symptoms. Now, sometimes there's another reason for you to have that. It's very common to get with diabetes, some thyroid issues. It's a common problem to have in pregnancy as well. And then sometimes other issues like a fracture or an autoimmune disease can also cause some of those can cause carpal tunnel. Okay, and if anyone out there has questions about carpal tunnel, we can certainly go through that. If you have questions about other conditions in the hand, that would be okay too. We could certainly go over some of those issues as well. Well, we could talk a little bit more about trigger finger. There was a question earlier about that. I briefly mentioned some of the options for that and mentioned that you can do surgery for trigger finger. That's usually a pretty small surgery. I usually do that with just a local medication where you just numb the area where you have the trigger finger. And then typically you just have to release that tendon sheath that's causing the pain. It's about a 10-minute procedure, and usually the recovery is quite quick. Typically you'll have a little bit of soreness in the palm for about 6 to 8 weeks after that, but most people get pretty good motion after the surgery. We do have another question. The question is, why does carpal tunnel cause you to drop things a lot? So that's a good question. One problem with carpal tunnel is that you have numbness in the fingers. That doesn't, and then when you're holding objects, you don't have good feedback anymore, and it can be hard to manipulate the object when you can't feel it very well. The other issue with carpal tunnel is when it's squeezing the nerve, it can cause an issue with something we call proprioception. So that's your body's concept of where your limb or where your fingers are in space. So if that's a problem from the nerve being compressed as well, that's another thing that can lead you to drop objects pretty commonly. And in severe carpal tunnel, you can also get some weakness in the muscle. You can get some wasting of the muscle. So that really affects your grip, and that can also be one of the reasons why you get that. Thanks, Jessica. Thanks for that question. Okay, well, if anyone has any questions that I haven't answered, we have a link at the bottom. Feel free to call us and make an appointment. We can go over any of your hand-related issues. And again, I'm Dr. Matthew Walker. We talked a lot about different conditions in the hand, especially carpal tunnel today. And thank you very much for your time.